Okay, today we're going to go through neuroanatomy for patient care. Upper extremity, lower extremity, their names, their functions, and the symptoms for when we get these things damaged. So this picture here I have so that you can have a bigger picture to look at. It's going to be a little smaller when I look at it like this, but you can always go back and freeze that frame there if you want to look at the larger image. So we're going to start with the ulnar nerve. The ulnar nerve provides sensation to the hand, especially the small and ring fingers, and contributes to muscles that will bend the wrist. It travels around the inside of the elbow and across the wrist. It does not go through the carpal tunnel. Now I want to show you, let's go back to the close-up here. Here's the carpal tunnel here. It's this strip of tissue, it's called a retinaculum, that goes across the wrist here. That tissue is what is called the carpal tunnel. Now here's a carpal tunnel here. Notice it's not going through the carpal tunnel. This is the ulnar nerve here. Okay, as it was described, and then it's labeled and named here. Notice it's on the top, never going under that carpal tunnel. If you hit your funny bone and get a shooting pain down the arm, what did you actually hit? That's your funny bone, right? Because it actually is exposed. It's pretty shallow in the arm, in that little crook in the back of the elbow. Now, the radial nerve contributes to muscles that bend the wrist, fingers, and elbow, and it provides sensation to the back of the hand and the thumb. So this is the opposite side, right? A lesion to the radial nerve can cause weakness and extension of the fingers. We're talking about the thumb side over here. Here's the radial nerve coming on this side. What bone of the forearm does the radial nerve run over? As a hint, the ulnar nerve is going over the ulna. So if you can guess, it's the radius, right? The radial nerve goes over the radius, the other bone of the forearm. Now the median nerve, as the name implies, is coming down the middle. This here, we're coming down as the median nerve. Now the median nerve actually does go through the carpal tunnel. Median nerve provides sensation to the hand, it travels down the middle of the forearm and crosses the wrist through the carpal tunnel. Damage to the median nerve can cause numbness, tingling, and pain in the thumb and first three fingers. So it's basically this first finger, second finger, and usually it's the inside of this finger here, or rather that would be the lateral, to be more correct. And then the ulnar nerve is the pinky, and then the ring finger usually on the medial side. What is the name of the common lesion at the wrist that causes lateral hand numbness? Now, I know there's a lot of terms and jargon in there, but if you're paying attention to what we've been talking about, you should be able to get that, right? We're talking about carpal tunnel syndrome. Carpal tunnel syndrome is when this nerve is lesioned or damaged, inflamed, that kind of thing. And this is the carpal tunnel. That's where that happens. So they call it carpal tunnel syndrome. Now, if a patient comes in and they're having numbness in their pinky and ring finger, that's not carpal tunnel, although it often gets misdiagnosed as such because this isn't something that a lot of people look at every day. And if their focus is mostly internal medicine, a lot of people can make simple mistakes like that. Now, here's again the close-ups. You can come back to this and freeze this frame here for the lower extremity. And then here it is from the back side. You can pause this if you need to. Okay, so we're going to go through the sciatic nerve. This is from the front, and this is from the back. Now, pain caused by compression or irritation of the sciatic nerve by a problem in the lower back is called sciatica. Common causes of sciatica include low back conditions, hip conditions, spinal disc herniation, right? That's when you actually have the disc between those bones that pokes out and hits on that nerve. Then you also have degenerative disc disease, which is when the whole disc just kind of starts getting desiccated. Basically, it loses its water content and it loses its height, making it so that these nerves don't have room to come out of the spinal canal. That's a broad and it's general, so it can actually happen on both sides. Now, lumbar spinal stenosis, that actually kind of goes along with that degenerative disc disease. And spondylolisthesis, that's when actually one of these bones will slip forward on top of the other one, which is another way that lumbar spinal stenosis can happen. And of course, piriformis syndrome is, see this muscle here? It's labeled piriformis. This muscle here can actually strip right over top of that sciatic nerve, and if it gets overly tight or inflamed, runners get this kind of thing, that can cause pain shooting down the leg there as well. Now, which of those factors could cause sciatica bilaterally on both sides? Well, we know that piriformis syndrome cannot, right? You'd have to have piriformis syndrome on both sides, which is possible but not as common. So we look at the other conditions. Now, if it's a hip condition itself, that's also not going to be a cause for bilateral sciatica. So when we look at the other ones, like disc herniation, if you had a certain kind of disc herniation, it could affect both sides. But generally, these other ones, spondylolisthesis and degenerative disc disease, those ones are going to cause bilateral disc herniation, bilateral sciatica. And of course, a patient can have any combination of all these things. So remember, when we're looking at patients, they can have some of all of these things on top of, they may also have neuropathy in their feet as a separate condition. And that's when we can do different setups from the low back all the way down to the feet. All right, femoral nerve lesion symptoms. So we're looking at the femoral nerve here. Here you can see it labeled. Here you see it plugging into these different muscles. Okay. So femoral nerve lesion symptoms, numbness, tingling in any part of the leg, typically the front and inside of the thigh, but potentially all the way down to the feet. It's a dull, aching pain, often in the genital region, and lower extremity muscle weakness, difficulty extending the knee. Now, from all that information from the picture over here, can you see what muscle groups the femoral nerve actually innervates? So this front group of muscles on the leg, we're going to call that the quadriceps group. And so if they have difficulty extending the knee, you can test that by having them push out against your hand, see if their leg is strong, and that's a good quick test for the femoral nerve. Now the saphenous nerve, notice this right here, saphenous nerve. Saphenous nerve entrapment is frequently overlooked as a cause of persistent medial knee pain in patients who experience trauma or direct blows to the medial aspect of the knee. Because the saphenous nerve is purely sensory, an isolated injury to this nerve should not result in weakness. Can you see what nerve the saphenous nerve branches off of? Follow it back up. Can you see? It's a branch of the femoral nerve. So it's a sensory branch of the femoral nerve. It comes on the inside here, and if you do get damage to the inside of the knee here, you could damage that nerve separately of anything else, not causing any weakness, not causing any other problems, except just this nagging knee pain right here towards the medial side. Now let's look at the common peroneal nerve. Now this one is going to be especially important because a lot of times we're going to start our treatments up here for our lower neuropathy patients, right along the side here. So common peroneal nerve symptoms include decreased sensation, numbness or tingling in the top of the foot, outer part of the upper or lower leg. Now a symptom would be foot drop, unable to hold the foot up into dorsiflexion, They call it a slapping gait. You'll hear kind of this clomping like that as people walk. And if you hear it on one side, you know that their problem is only on that other leg and not a central problem. So their toes drag while they walk. That's another problem. What could this be a risk factor for? What kind of problem could a patient also get from this? They could have falls, of course. So this is the kind of patient, we have lots of patients come in with those little boots that kind of hold their foot up. Of course, they have some name like AFO or something like that, I think. And it's like an ankle foot arthrosis or something like that. And it holds their foot up into dorsiflexion so that they don't actually have that foot drop down, because that could be very dangerous because they could trip over just about anything. Now the deep peroneal nerve is of course a branch off of that nerve, the common peroneal, and it's coming along through here towards the inside. So the nerve is a branch. This nerve is the branch that's responsible for the big toe, also known as the hallux, and dorsiflexion of the ankle. So dorsiflexion means to bring your ankle up, right? And plantar flexion is when you push the foot down. So it provides sensation to the medial foot on this side. And as a quick test, what's a good way you could just test the deep peroneal nerve? So since we know that it's responsible for the big toe, you could easily just have them push up. If they can push their big toe up against your finger and it feels strong, then you know that that nerve is at least strong. Doesn't mean it's perfect, but it means it at least hasn't gotten any weakness yet. Now let's look at the other side. The superficial peroneal nerve, that's coming on this side over here. That's the lateral side. This is responsible for muscles that move the foot outward. That's called eversion, right? So that's if you were to bring this foot out in this direction. It also provides sensation to the foot everywhere except the medial foot. So basically everywhere that the deep peroneal nerve did not do sensation, this does all the rest. So which nerve provides sensation? Oh, sorry, I just gave you that answer. Which nerve provides the sensation for the medial foot? You should definitely get that question because I just mentioned it. It's the deep peroneal nerve. Right there, you can see it coming to the medial side, covering the big toe. All right. Well, that's okay that I gave away that question because now I actually have a quiz that you can do. So find the link to that and good luck on the quiz. And you'll always have this to refer back to. All right. Let me know if you guys have any questions, and I hope this was very helpful for you.